I'm going to go through these next few slides pretty quick because hopefully it is a review. Normal rates are 12 to 20, but when we're on the vent, we slow that down a little bit. 10 to 12, or we say 8 to 12 even sometimes. Higher rates can be used with patients with lower lung compliance. Patients with lower lung compliance have stiffer lungs. That's your ARDS patient. So again, we have lower rates, which increases CO2, and that's permissive hypercapnia. More PEEP, lower minute ventilation, low tidal volume, stuff like that. We do not use high rates with people who have obstructive disease because they already have air trapping. If we increase the rate, they'll get even more air trapping. Then it talks about kiddos, but we will talk about that next semester. Changes in metabolic needs can change the minute ventilation, and this just talks about that. Patients with hypermetabolic states would be those who are really, really sick. Those with really high temperatures. Our burn victims have higher metabolic rates. But again, normal is 5 to 8 liters per minute, and hopefully you all remember that. This is an equation that you can use in the real world all the time. It's kind of like known over known equals desired over desired that we learned with oxygenation. So here's an example. If you have a patient with a CO2 of 62 and his minute ventilation is 8, but you want to get a CO2 to 40, how do you do that? So this is a math equation to tell you how to do that. The next slide talks about patients who have had maybe a lobectomy, which is part of their lung removed. Happens a lot with CF patients, those who have recurrent infections, that type of thing. Again, we will use a lower tidal volume and then just increase the respiratory rate if their minute ventilation is not enough. And the next slide talks about setting up the minute ventilation in pressure or volume. So inspiratory pressure is the same as plateau pressure on your volume control vent. So if you have a patient in volume control and then you want to put them on pressure control because you decided that's a better mode, because it is, you look at your plateau pressure and that's what you set your pressure and pressure control. I know that's hard to explain without a vent, but we can do that in the lab so you understand what that means. If you don't have the plateau pressure, which you will because you have a waveform and you have an inspiratory hold, but if you don't, for whatever reason, you can use PIP -5. Or you can just start at 15 and until you get a desired tidal volume, something like that. Always set your tidal volume 5 to 8. So even though you're in pressure control, you can still get a tidal volume of 5 to 8 milliliters per kilogram of ideal body weight. Okay, so that's that part.